good afternoon, good morning, or good evening, according to where you are based today. I'm Alessandra Rezu. I'm the Director for Global Health at Humanity and Inclusion and the co-chair of the Inclusive Health Task Group at IDDC. See me well. So
yes, we can.
Perfect. It is a pleasure for me to facilitate this session dedicated to health and build back inclusively. The first 45 minutes will be dedicated to health, and then we know that the second 45 minutes will be dedicated to livelihoods. As a reminder, the Inclusive Health Task Group of IDDC is composed of 3 co-chairs, so I'm facilitating on the behalf of all of us. The second and the third co-chairs are Nick Corby and Andrea Pregel. And I take this opportunity also to thank Andrea for all his work in putting together this panel. It was great to do this together. Can I ask you, before starting with some remarks, if you could keep your microphone closed, muted, while others are speaking, and if you are not speaking, just to make sure that the background noise doesn't interrupt the presentation of the speakers. And if you can keep your video on when you are presenting, that is also very much welcome. The captioning service is also available together with the sign language interpretation, and you should be able to use this service. Please, if you have troubles, if you have problems, use the chat box to let us know, so that our colleague Angelique can help us in solving this problem, if that happens.
Yeah, thank you.
Give me only 1 second. Perfect. So this panel today will have the pleasure to welcome 3 contributions, 3 speakers. The first speaker, Alarcos Cesar from WHO, is the unit head of sensory functions, disability and rehabilitation division. Will be Dr. Yaya Disu, the head of risk communication division at the Nigeria Center for Disease Control. And our third speaker will be Christopher Agbega, coordinator of COVID-19 initiatives at Ghana Federation of Disability Organizations. Each of the panelists will have a few minutes to share their inputs and their reflections on this very important time of COVID-19 response from the disability inclusive perspective, as well as building back inclusively. And then, of course, there will be a space for questions and answers as the presentation are over. As a question come to mind while listening to the presentations, please do include your questions in your chat box, including also the name of the speaker you would like to ask your question to, so that we can ensure our speakers can address them one by one, and can have as many questions as possible covered. Before giving the floor to our speakers, I want to just bring you up to speed with what the Inclusive Health Task Group of IDDC has been working on in the context of COVID-19 disability inclusive response and build back inclusively, because I don't assume that all of you are updated on the subject. Of course, it has been a very long year full of initiatives, starting at the beginning of the pandemic, our cooperation with the core group platform in creating a repository of resources on COVID-19 and disability inclusion that were at that time aimed at start gathering some information and key materials at the very early stage of the pandemic. We then move forward, joining forces with the International Disability Alliance throughout the months to promote a disability inclusive COVID-19 response campaign, asking for the right to health of persons with disabilities to be acknowledged, respected, and promoted. Of course, we went on throughout the months and most recently with the campaign on COVID-19 vaccination. In addition to the very focused activities on COVID-19, as a reminder, as COVID-19 has certainly exacerbated the barriers that persons with disabilities face when it comes to access to health information and services, certainly in the last few months, more and more the fact that there is more and more attention to the Article 25 of the CRPD dedicated to access to health, and the fact that we are still far away from seeing the rights to the highest standard of health for persons with disabilities to be fully respected in many countries and translated into practice. And what we observed during the COVID-19 confirmed really the need for a World Health Assembly resolution on the highest standards of health for persons with disabilities, that in fact the core group of WHO member states were already discussing out for many months already when COVID-19 entered in our lives. And we had, as IDDC, the opportunity to be part of influencing action and a collaboration to make sure that the contents of this and the language of this resolution also respect and reflect the ideas and the contributions of civil society organization and OPDs. This action of influencing the WHO resolution draft was done once again in collaboration with IDA. Of course, we will hear more and more about all these elements directly from our speaker from WHO. That is today with us. And so we are very, very grateful to have Alarcos with us today. I do not want to take more time. I really would like to pass the microphone directly to you, Alarcos, to invite you to share with us some of your reflections and inputs on the step that WHO has taken to promote disability inclusion in COVID-19 response, but also with a view of building back better what are the steps WHO is taking to promote the development of more disability inclusive health systems and services. And I will really also, if you have the time, ask you to share with us a little bit more. What do you think the stakeholders such as IDDC can and organization of persons with disabilities can really support WHO in this process? This is our let's say our first question, multiple questions for you. I will give you the floor, Alarcos, and you will have up to 8 to 10 minutes to share your inputs. And thank you again for being with us.
Thank you, Alessandra. And let me also start with saying thank you and emphasizing what a great pleasure is for me to be here today representing the World Health Organization. And I will be as brief as possible so that there is time for discussion or for questions. Regarding the first question, what has been WHO response regarding disability and persons with disabilities during the COVID-19 outbreak? And let me emphasize that the response of WHO has been strategic more than operational from the beginning. So if WHO announced on January 30th of 2020 that COVID-19 is a public health emergency of global relevance, it was March, the 6th of March, and we have the first guidance on disability considerations during the COVID-19 outbreak. So it took us only 6 weeks to put that guidance forward, and it was one of the first documents that actually WHO released at that point related to COVID-19 as a whole. And because we saw that it is of fundamental importance to strategically to attract attention to the agenda of persons with disabilities and how persons with disabilities were being left behind during the outbreak. So there were recommendations for persons with disabilities themselves, but also for the general public, for healthcare workers, for disabilities, service providers, and for governments. What we did also immediately in March is to link very closely with the UN with the UN office, specifically with the Office of the Undersecretary General responsible for disability. And we called for a webinar inviting all other UN agencies as well as civil society and organizations of persons with disabilities and UN country teams. And the reason why it was so important so early in the pandemic to come together is because immediately it was clear that we couldn't look at COVID-19 only as a public health emergency. COVID-19, as we are seeing, has tremendously socioeconomic consequences, as we knew that if we don't bring a global response together, then persons with disabilities again will be left behind. So during this webinar in April was tremendous emphasis and also motivated the Undersecretary General to ask the Secretary General of the United Nations for the policy brief on disability that came out already in the first week of May. That also attracted a lot of attention to ministries of health of having to put an emphasis to the disability agenda. We move forward then in time, and WHO then led one of the work at UN level on the COVID-19 health response. And one of the main focuses was to bring at country level this guidance and these disability considerations during the COVID-19 outbreak. We translated this guidance to 22 languages. We work with UN country teams, with our regional and country offices to really bring this as close as possible to the partners in the ground so that advocacy could also take place at country level. Then we move forward also in the time, and the UNPRPD, the UN Partnership on the Rights of Persons with Disabilities, they put forward the project on building back better for persons with disabilities. And WHO played also a leading role in this group. And thanks also to the collaboration with IDDC, we could move forward with 2 essential pieces of work. The first one is putting all the data together in terms of the information that exists, to what extent persons with disabilities has been, or that there is data on or the augmented mortality of persons with disabilities during COVID-19. We collected all the evidence. We came to the conclusion that actually we could say with confidence that persons with disabilities have been, or they are at an increased risk of being infected by COVID-19, that are at an increased risk of developing severe symptoms or even for dying from COVID-19, and that even if they don't get COVID-19, the health outcomes of persons with disabilities are also impacted negatively. So this paper is written and is now a publication that is under revision, and we expect that will be also published very soon. This information also was used for an additional document that we launched recently, also in collaboration or with the input of IDDC and the input of organizations of persons with disabilities, that was guidance and disability considerations for COVID-19 vaccination. And last but not least, I also would like to mention another activity that we are carrying out with IDDC, and that is the development of accessibility standards for telehealth. Because as you well know, the health sector have moved, and service delivery have moved tremendously to telehealth services. However, there is not accessibility standards. We are working with the International Telecommunication Union and also with IDDC, and we will be launching these standards later this year. And again, emphasizing that all these activities have always been done with the perspective of what strategically we could do so that the agenda of persons with disabilities and persons with disabilities get attraction and attention at country level, and that also our partners can use those messages. We have to recognize, however, and I think that is what bring me to the current agenda moving forward from WHO. We need to recognize that disability is not at the core. The agenda of persons with disabilities and disability inclusion is not at the core of the attention of the health sector. And that is something that needs to change moving forward. And one of the things that COVID-19 has done is to bring this to the attention of ministries of health. And that is really like the positive consequences of not a positive outbreak like COVID-19. That really, it cannot be denied that disability inclusion has not been in the agenda of ministries of health. Luckily, proposing a resolution during at the World Health Assembly that will be endorsed next week, asking WHO to move forward with this mandate. And the mandate is disability inclusion in the health sector. And this means now three things, or moving this agenda in three pillars: making sure that health systems are inclusive of persons with disabilities, that all the barriers that persons with disabilities encounter are identified, are addressed, and approaches are developed to address those barriers. Secondly, it means a second pillar, that is how to make sure that the needs and requirements of persons with disabilities are included in the health emergency preparedness and response plans. And the World Health Assembly resolution also requests WHO to take action toward that and develop guidance. And third, but not least, or the last but not least, is about making sure that all cross-sectorial public health strategies that are implemented in order to improve population health are inclusive of persons with disabilities. And one of the typical examples is water and sanitation, but it is also health promotion and making our health promotion strategies also inclusive of persons with disabilities and so on and so forth. So it is really concentrating in these three pillars, and then a cross-cutting action, that is the action of data and data of persons with disabilities also in health information systems. That is what the World Health Assembly resolution is requesting from WHO. The World Health Assembly resolution also requests the civil society and organizations of persons with disabilities to be part of this action. And WHO, when moving forward with developing all these Health Assembly resolutions, will consult with organizations of persons with disabilities, and also, of course, we come with IDDC as a partner moving forward. So I stop here, and then happy to answer any questions or have a discussion.
Thank you. Thank you, Alarcos, for your contribution and your reflections so far. As mentioned, please stay on the line to ensure that we can hear the other speakers and then receive all the questions from the audience. And I would like to mention that, of course, there will be this week an event led by WHO and member states and some selected member states with the support of IDDC on the resolution that Marcos has just mentioned. I will make sure that I drop a link in the chat for everybody so that you can also take part and follow the conversation around the resolution before the World Health Assembly starts. While doing this, I'm really happy now to give the floor to Dr. Yaya Su from Nigeria. I look forward with all of you to hear from him a little bit more of an overview on the work that has been done by the Nigerian Center for Disease Control to include persons with disability in COVID-19 health response in the country. And if possible, please share about the ongoing discussions on building back better and the inclusion of persons with disabilities. Thank you, and the floor is yours, Dr. Disu.
Good afternoon, everybody. And I want to thank the organizers of this workshop for giving us the opportunity to share our experience in Nigeria in the forum, how we have dealt with the disability sector to mitigate the impact of COVID-19 on that sector and the entire population. It has been a learning curve for us because before now, we knew how to engage with wonderful colleagues. But recently, we now know how to deal with them because we now do relationship with stakeholders from that sector. So I want to start with what Nigeria done during COVID-19 period. First was that we were able to, first and foremost, work with disability-related organizations like Deaf Resource Center, and then also National Association of Sign Language Interpreters, and to be able to do the following. And then we involved them in strategy development, and they were incorporated into the risk communication and community engagement pillar in NCDC. That way, we understand the needs of this group of people. And then when Presidential Task Force was also created, there was this link of the National Association of Sign Language Interpreter to PTF to enable them interpret the information during presidential press briefing. So that is first one. So any other decision we want to take, they are part of the pillar. In fact, they even sometimes they may bring somebody who has disability with hearing, and there will be an interpreter interpreting and letting us understand their own perspective. So the second thing is in the messaging development. That is why we work with these organizations. So involve development and design of our social and behavior change communication materials, like definitely jingles, brills, and then also in the elimination of those items. And then also when it comes to, like I said earlier, PTF, Presidential Task Force daily briefing, are also involved in interpreting those information. And we also link them across the states. The states are ready to ensure that they absorb the services of this association. Then the second thing we're able to also do is media advocacy. We partner with Lagos State Ministry of Health in ensuring that this group of people, they are able to support interpretation, to organize media training for media, and have engagement meeting with media. And then the organization were also involved in that meeting. And then what did we achieve is to promote access to information by ensuring that they interpret their languages, they hear the jingles, deaf-ready jingles that we produce. And then it will also encourage the media to advocate on their behalf to policymakers across all levels. So what is the consideration for disability sector? It's in policy and funding, at least relating to COVID-19 intervention. So those are things that we are able to do. And then the third was the establishment of National Commission of Persons with Disabilities in Nigeria. And this was as a result of realization at the Presidential Task Force level that these are a group of people that have been excluded. And now they have a commission, and then they've already given them office, and they've constituted their members, and majority of them are from the group. And last week, as we speak, they pay a courtesy to the Director General of Nigeria Center for Disease Control, who has promised to support and to make sure that they are included in whatever programs that we are doing. And then we have already incorporated their representative in the National Risk Communication Technical Working Group for the country. This is a strategic group that develop and determines direction for risk communication and community engagement in the country, not just COVID-19, but other infectious diseases, hazards, disaster, conflict, and so on and so forth. Because it's made up of ministry, departments, and NDAs and partners, both local and international partners, and that develop guidelines for the country. So it was a very welcome development that we now have agency from the federal government that can also act like as NDA that we can relate with. So those are major achievements, things that we have done so far. And then future plan includes, we want to now leverage this platform that has been created by the federal government of Nigeria, that is the National Commission for Persons with Disabilities in Nigeria, to conduct mapping of stakeholders working in disability sector. And then that way, we're able to work with these stakeholders and in designing framework for assessment, for conduct assessment among disability groups, understand the potential burden and impact of outbreaks in this group, because that is when we can begin to think of, okay, how do we design? Of course, it will be included in the design of this framework, since we're the National Coalition for Persons with Disability in Nigeria. Also, we through this, we also want to design a method or mechanism for understanding their communication support needs, so that whatever we're doing is targeted. Now, the second major thing is to fully incorporate the stakeholders in strategy development and message development and dissemination in the country. Whatever we're doing, irrespective of the disease outbreak, and they will be part and parcel of this, because they constitute a significant proportion of the population and they also have rights to health. And then the third one is the empowerment at individual and group level to take to enable them to take decisions and initiatives for preventing and mitigating impact of threats on the population. So those are things that we already planning. They have formed this commission. It becomes easy for us, and it becomes a very good legal lever to pull on. And then also to sustain the advocacy for the sector. Lagos is where we started with, and we want to ensure that we conduct it at national level, and then work with stakeholders, and as well and promote this at other states to ensure that they're able to where the state have closer connection with the grassroots where they meet with the population. And the last is to work with stakeholders and the commission to develop guidelines for the disability sector for future risk communication and community engagement. Thank you very much. Maybe let me just share this. At the beginning of COVID-19 outbreak, and somebody from Deaf Resource Center came to our office, inviting us to come and to give them materials for sensitization of people in disability sector, people with disabilities. And I told him that, look, why not join our pillar, risk communication community engagement pillar for COVID-19 containment, so that we can capture your needs. And so that was when he brought the first meeting. He brought somebody who could not, who has disability with hearing, and then with the sign language interpreter. And it was funny that the person said that all the jingles developed, they weren't accommodated, and they were excluded. So as a result, it was then we now realized that we really need to involve them, and they joined our pillar from that on. Thank you very much. Over.
Thank you very much for this presentation, Dr. Diso. And I see that time is running, and I know that all of you have a lot to share at the expenses, unfortunately, of a discussion, but I want to immediately give the floor to Mr. Christopher Agbega for his presentation, and thank you for trying to stay within the 5 to 8 minutes that we have allocated, so we can still have a few minutes for the questions and answer. Thanks a lot, Christopher.
Thank you so much, Alessandra. So what I'm going to do, and thank you for the opportunity to speak on such a very important one. I'm going to drive my point home as quick as I can. So generally, the Ghana Federation of Disability Organizations is a 9-member body looking at various types of disabilities, from deaf to persons with albinism, persons with autoimmune and neurological conditions, burn survivors, stammering, and we even go beyond that to look at persons with leprosy, persons with deaf blindness, multiple disabilities. And so it is important to understand that before COVID, there were a lot of health-related challenges for persons with disabilities. I'm going to keep my talk on health because there has been a lot of work around the economic side of things and social side of things, but just looking at health. And so, like I said, before COVID, persons with disabilities already had a lot of encounters with some barriers with regards to, healthcare, which is stigmatization and discrimination of persons with disabilities by health workers or persons that quote unquote should know better. Inaccessible building structures, as well as high cost of services and medications. Now, GFD, understanding the severity of the pandemic, we actually zoomed right into interventions when Ghana recorded its first 2 cases in March of last year, 2020. And what we've done over the period is we've conducted various levels of research, because if you're going to engage government, you should come with some levels of resources or data. So we've been able to carry out research on the impact of COVID-19 on persons with disabilities, on their social and economic impact, as well as health. We've also carried out a number of documentaries. What we want to do is we want to present a visual representation of what it means for persons with disabilities in these very challenging times. We've also carried out intensive COVID-19 education across the country. And what you have to understand is that when COVID hit the country, Ghana went under a lockdown period. And the lockdown was between 2 major cities in the entire 16 regions of the country, which was in the Greater Accra and Greater Kumasi regions. But what we try to do is we try to extend our intensive education beyond these 2 major cities. And we've done that. We've also engaged the health promotions of the Ghana Health Service to also understand the formats in which educational materials would have to be shared to persons with disabilities. And the reason is because persons with disabilities have different approach to how they access some educational materials. And so that has to be looked at. And that is one of the things we did. And that engagement, as I speak to you, is still ongoing. We also engaged district health directorates. So what we need to understand, or what I have to make you understand, is the government of Ghana rolled out some interventions in the area of health to ensure that persons with disabilities, have access to the healthcare needs, even within this period. So what we did is that we engaged persons with disabilities and the health directorates of these health centers in these districts to ascertain whether what the government rules to access for persons with disabilities, and that also came up with a lot of findings. Persons with disabilities expressing some levels of dissatisfaction, and the health directorates actually acknowledging the fact that a lot has to be done to bring on board the needs of persons with disabilities. So in Ghana, several interventions have been developed and implemented by the government, like I said, on the socio-economic aspects, but we are looking at health. And according to the emergency preparedness and response projects, and in accordance with the Act 715 of the Disability Act 715, which is in our constitution, all public health facilities were to ensure and to provide accessible services for persons with disabilities. And that is why we engaged the health directorate to ascertain whether that was the case. The government also went ahead to commission some ambulances during the period, and also the donation of 20,000 wheelchairs, which was just over 2 weeks ago. That was what the government did in the country. What I also need to acknowledge the government for doing is that in the beginning, the government began to address the country. The president, His Excellency Nana Addo Dankwa Akufo-Addo, was addressing the citizens on a monthly or a weekly, 2 weeks basis. And one thing we recognized was the barrier in accessing, that communique, because in persons who can't hear and there was no sign language interpreter, how then do we bridge that gap? So we reached out to the Office of the President, he welcomed us, and we were able to bridge that. So the Ministry of Information, the Ministry of Health, and the Office of the President began to bring on board the services of sign language interpreters so that they are able to meet the needs of persons with disabilities, breaking the communication barrier. Now, just to speak on a few things and then I end it. Over the period, what we've begun to see is that there is a big gap between the interventions that government is rolling out and the needs of persons with disabilities. We have been calling for universal health coverage for a very long time. And it is very clear that this is a time that even needs more attention. And so we are carrying on with our advocacy efforts, ensuring that the people in the authority or the stakeholders understand the need for that increased budgetary allocation for universal health with targeting persons with disabilities. Let me bring our attention to this. I mean, in wrapping up. During the last year, if I should put it, we remember how the president of the US came out to state that hydroxychloroquine was actually a medication that could cure COVID. We heard talks about that across the world, that there was a cure for COVID and it had to do with hydroxychloroquine. What people failed to understand was that hydroxychloroquine was actually a medication that was taken by persons with autoimmune and neurological conditions, whether there was a pandemic or not. And so when that medication came out that it was a cure, the prices of that medication skyrocketed, and it affected persons with disabilities who were already facing issues and challenges with regards to purchasing these medications. So within that period, we suffered high levels of anxiety and depression, but the Mental Health Society of Ghana and the Ghana Health Federation of Disability Organizations have been able to come up with some psychiatric interventions for persons with mental health complications. One of the key things that we are calling for is that we are looking out for the meaningful involvement of the Ghana Federation of Disability Organizations in most of these governments laid down protocols, because believe you me, if GFD is not involved, GFD being the mother organization for persons with disability in Ghana is not involved, we are going to continually see a lot of interventions by the government, which is going to lack the needs of persons with disabilities. And that is what we are fighting for. Currently, we are also championing a lot of education around the vaccination because it is very, very important that the citizens are vaccinated. But for persons with disabilities who have underlying health conditions, the approach has to be very systematic. It can't be done because you find persons with disabilities just as generally the citizens in general. No, that is not, it has to be done systematically. And also with the advocacy that we are championing, we are trying to break down the myths and the conspiracy theories around, the vaccines, and if you take it and the health complications you could have. There's a whole lot, but because of time, this is generally what has been happening in Ghana over the period. Thank you.
Thank you, Christopher, for all the information and for sharing. And because I didn't see so many questions in the chat, and because the most difficult task of a virtual conference is to interrupt very passionate speakers when they are speaking without really being too aggressive. So intentionally, I let people really share. We have, with the kindness of the next session, 5 minutes more to take some questions, please. And I see only one question in the chat, so I jump on it to make sure that we can at least address this one. I believe that no questions means that you have been extremely, generous with your information so far. And the question is for our speaker from WHO, and with the thanks for the presentation and for the great. It is great that the WHA resolution is coming, but there is NDR, which is an important service for the poor in the poor countries. This is the comment in the chat. I want to give the space to Alarcos to respond to this comment before closing the session.
Thank you, Alexandra. And let me say that I was really grateful to hear also the contribution of IAIA and from Nigeria, and also Christopher and Creative for universal health coverage. So I think that is something that we need to do, all of us, moving forward. And but now related to the question of Stephen regarding CBR. And it is an extremely important question. And let me say, it is not that WHO does the resolution of the World Health Assembly. That is really what it is drafted by member states. So the inclusion of community-based rehabilitation should have come from member states and ministries of health to include it in the resolution. Having said that, and it was not the case. What one could even question why that was not the case. But having said that, let me say something. And as you well know, that what WHO is doing is really disentangling the agendas of rehabilitation and the agenda of disability inclusion in the health sector. Rehabilitation is an extremely important strategy that we are moving based on the Rehabilitation 2030 initiative, where rehabilitation delivered at the community is a fundamental part of this strategy. And disability inclusion in the health sector is what we are moving now, moving forward with the resolution and the request of the resolution. We potentially, and we would welcome it very much if member states come forward in the future also with the resolution for rehabilitation. I think this disentangling, it is important because in the last years, it has not been beneficial, neither for the agenda of rehabilitation, not for the agenda of disability, being entangled in such a way in countries. Because in many countries, it has been perceived that rehabilitation is only for persons with disabilities, what has led to the fact that rehabilitation has not been perceived as a service, universal health coverage. It has been the prioritized, undervalued the resource, and that also to the detriment of persons with disabilities who benefit, of course, from rehabilitation services. Also, there was the misunderstanding that all the service in many countries, that all the services that persons with disability needs is rehabilitation. What it has agenda of disability in the health sector. So for that reason, I think this disentanglement and this separation on both agenda, one, disability inclusion in the health sector with a new resolution is very good news, and the rehabilitation agenda in the context of Rehabilitation 2030. Now let me talk about this community-based inclusive development. And I know that many of the stakeholders of community-based rehabilitation identify with the terminology and identify the community-based inclusive development as a cross-sectorial strategy to empower persons with disabilities in the community, and that not only address health, but also education, also livelihood, also labor, and all of the life of persons with disabilities. This is a strategy that needs to move forward under the leadership of all the different sectors. Currently, WHO is planning together with the High Commission in Human Rights what is the best approach of moving this agenda of community-based inclusive development also in a cross-sectorial strategy involving all the different sectors and all the different UN agencies responsible for all these sectors. And you will be hearing more and more in the future on an initiative and strategy that will be called Community 2030, and hope of those that are passionate for community inclusive development. So I stop here.
Thank you, Alarcos. Thank you, you and two speakers from Ghana and Nigeria. We have really come to the end of this session, and we have almost abused the patience of our colleague from Livelihoods who have been waiting for the next session. Apologies for this. So we close here the thematic session on COVID-19 recovery and disability rights dedicated to health at the General Assembly of IDDC. Thanks again, and I give the floor to Simon for continuing the session on livelihood. Thanks again for everybody for your contribution and for attending this session.
Thank you.
Thanks, Alessandra, and thanks, Alakos and Yaya and Christopher for a fascinating session. The second half of this webinar, this IDDC session, is going to look now at the economic recovery and disability rights in that. Yeah, we've spent some brilliant time talking about the health parts of it, and now we're going to look at the economic part. By way of introduction, my name is Simon Brown. I co-coordinate the Livelihoods task group with Annika Maz from Light for the World, who joins us today from Gulu in northern Uganda, and hopefully with a reasonable connection. We're fortunate to have a panel who can give both a global view as well as a national or local Ugandan view of that economic recovery and the disability rights within it. And let me quickly introduce them. We have Deborah Ayuti from the National Union of Disabled Persons of Uganda, NUDIPU. We have Douglas Opayo, the Executive Director of the Federation of Ugandan Employers. And then hopefully, Stefan Trommel, the Senior Disability Specialist from the International Labour Organization. Stefan is replacing Jürgen Menzer, who was supposed to be on the panel today, but unfortunately is not very well. And Stefan will join us as soon as he finishes with a GLAD meeting, which he's leading, hopefully in a few minutes. But first, Douglas, I'm gonna start with you, and because I think it's very important that we learn from your grounded experience. We know Uganda has managed the health pandemic particularly well compared to many other countries, but also as we look at the macro level economic impacts, at least statistically, it looks equally promising. That the economy, the gross domestic product on a financial year basis last year continued to grow, albeit at a reduced rate, and only marginally contracted when we look at it as a calendar year basis, the 2020 year basis. We know from the incredible data that's available from the Bank of Uganda that agriculture and industry look fairly resilient after the initial shocks in that first wave from April to June. But the services sector really suffered and continued to struggle as recovery begins to happen. But can you tell us about the journey from a Ugandan economy perspective over the past year? How you see the recovery continuing from a Ugandan perspective, and whether you see signs of that being more inclusive of disability than perhaps it's been in the past. So Douglas, maybe in 5 or 6 minutes, could you give us a short kind of presentation on those areas, please?
Thank you so much, Simon, and thank you for inviting me. Thank you for having me today. Now, you're absolutely very right. The Ugandan economy didn't suffer as much as we had feared. So basically, we have had the economy growing, but of course, like you note, at a reduced rate, actually less than a half. So the previous year growth was at 6.8, but now the GDP growth reduced just to 2.9. But again, in the coming year, the projection is rather positive. It wouldn't still go back to the pre-COVID period. We are looking at about 4.3% growth in the coming year. Now, the situation, like in many countries, was rather intense from around March to June. That's the period in Uganda when we had near total lockdown. So businesses were basically closed. The few manufacturing entities that had to operate, business was basically near, I would say, almost shut down. But then 2020 has been a lot more positive, and we have had the constant easing of the lockdown measures instituted by the government. The restrictions have remained, but for a few sectors now, and a few of those industries. But we have seen a lot of improvement. But what I can say is that even this uptown is a bit even because we are prone to shocks from the external world, given that we are involved in import and export trade. So we are still affected. The revenue in the country, we had a significant shortfall in revenue. Some of the infrastructure projects the execution has been slow, and our economy relies a lot on investments in infrastructure. So those affected us. But overall, the economy looks solid. The Ugandan shillings has remained relatively stable. The private sector credit has again started in the last quarter of the year. It grew by about 8.6%, implying the confidence levels growing again. Businesses are beginning to borrow. And the route ahead seems a lot better. We are looking at now the vaccination process has started. As I speak now, about 430,000 doses have been given. So the future looks a lot more positive, and the president is promising once we reach 5 million people vaccinated, which is still a small proportion of our population. The target is about half, about 21 million people. But if we reach 5 million, is promising to open a bit more. So we see the future ahead good. Now, turning on to what does this mean for disability inclusion, especially in the world of work? I think it was sort of an awakening call for many employers. For the first time, there was so much attention on matters of health. And in this regard, disability inclusion and general labor matters benefited from it. We had a lot of renewed attention from the stakeholders, even us. As the Federation of Uganda Employers, we worked extensively around this period on awareness raising, working with Light for the World, ADD International, Site Savers. Deborah is here with us. We worked very closely as well with Nudipo. So the pandemic helped to raise awareness on this of persons with disabilities, which was already not good. And we have seen since then a lot of commitment from various stakeholders. Just to give you an example, in Uganda, based on our last census estimate, we estimate persons with disabilities from 12.4% population. But we have seen companies, for instance, like Uganda Brewers Limited, committing to employ at least 12.4% of their workforce as persons with disabilities by 2030. We have seen commitments that previously weren't there. We have seen Coca-Cola committing to provide certain segments of their businesses for persons with disabilities so that they can get employed, they can improve on entrepreneurship. We have seen even during the lockdown, some of the companies taking advantage to redesign their buildings, improving accessibility, utilizing the period when the lockdown was there. We have seen also the disability network that we created together with the partners I've mentioned in Uganda, the Uganda Business and Disability Network. We have seen entities joining and making commitments of various kinds. So we have seen a step in the right direction, so to say. Even at the Federation, we were working to a need to do a little more. Right now, we are building a platform for job matching, essentially a job portal. And we are looking at futures that are disability friendly. It was never the case before. We wouldn't be designing website and asking experts on disability to help us. We have also seen renewed interest from employers who are asking us, do you have any recommendations of persons with disabilities whom we could employ? Some are consulting us to develop their workplace policy. So that's what I can say. The attitude has changed, but changed for the better. Change towards appreciating the importance of employing persons with disability and the value that they bring to the world of work. So thank you so much.
Douglas, thank you. I know how passionate you are about disability and inclusion and your leadership of the Uganda Business and Disability Network. And I've been lucky enough to see that early design of the web portal, the job portal. So I'm really happy. I'm really happy. Thank you. I will come back to you at the end with some questions, I hope. But I'm going to turn now to Deborah. Deborah, if you could unmute your microphone and maybe turn on your video. It's really important that we turn to you now and begin to put this in the perspective of disability and the experiences of communities of people with disabilities. Clearly, Nudipu represents the voice of people with disabilities across the country. And we know that people with disabilities have been particularly affected at all stages of the pandemic. I've got quite a lot of areas that I'd like you to focus on, to give us some opinion on. First, what has been the experience of people with disabilities during these phases of economic shock, of response and recovery that Douglas has been talking to us about? What voice did people with disabilities have in the Uganda COVID-19 task? Did that influence the response and the recovery processes? And what more needs to happen as we move forward to ensure that the longer term recovery is more inclusive, whether at policy level or the implementation of policy levels, social protections, and so on? Yeah. So Deborah, over to you to give us your opinion from Nudipu, but also then from the communities of people with disabilities on your experiences of the last year. Deborah. Deborah, we're struggling to hear you a little bit. Can your interpreter maybe come a little bit closer to the microphone?
Okay. Thank you. Thank you very much, Simon. I've been trying to experience. Sorry. In Uganda, on behalf of National Union of Persons of Uganda, how we policy. We have so many experiences that we got through that time. So first of all, the standard operation procedures were developed without consulting persons with disabilities. Also, the information on COVID started being spread upon, but persons with disabilities were not So there was a lot of gap in information getting. So in the area of economic empowerment activities, persons with disabilities got challenged because of lack of transport. There were no border borders for persons with disabilities to use in order to go to their places of work because they could not go. So at the end of it, they used all the profits that they had in order to continue lively in their lives. So their businesses got down and they ended up not having any business at all. You know, other people were said work at home, but also the tools, equipment had persons with disability had. Like for example, hearing impairment. You need to work and you need to have interpreter. The blind people would need support, devices at home, but all those were not accessible. So in most cases, many people lost jobs because of monitoring. I don't need to talk more about health because most of my colleagues have talked about it. So I want to talk majorly in the area of education. Information, there was lack of access. They are saying that homeschooling, but children with disabilities, students with the disabilities in university got a challenge because they didn't have access to information. They had nowhere to get that information. In the area of GBV, it mainly affected girls and women with a disability during the time of lockdown. Children with the disability were not safe. So the COVID had a negative impact on the health of persons with disability. Then another issue was security. One deaf person died because of the security issue. Then the other one was amputated, and also a deaf person amputated. So in the experience of Nodipu, we started to advocate and create awareness on persons with disability. Also, Uganda had the distribution programs, but persons with disabilities were never. Most persons with disabilities. So it was a big challenge. There are many challenges that we got, but what we learned out of the challenges, we saw that they were so gaps. There are many gaps. This is to wake up, to talk to the development partners, to load the funding, major awareness on COVID-19, and most information was taken to radios, TV, and also to talk to the members of parliament to see how to influence and how to involve persons with disability in access to information. When we advocated for this awareness, the media also started now using interpreters during their communication or announcement. So also the president's speeches always, they had to use interpreters. So, and also a member of persons with disabilities was put in the task force COVID group. So the COVID task force was to work hand in hand with the government to see how persons with disabilities would also be prioritized time of. So it was a good for us, and also for we saw that it was not good for us organizing persons, but was an open out. Yes, we have a lesson. So what do we want to do? What we are saying is very important to give financial compensation to all members who have disabilities. But the government program, give them how they can again analyze their business. So another thing that we need
Deborah, sorry to interrupt, but your interpreter has gone a bit distorted. Again, can she come a little bit closer to the microphone, to the computer?
Okay.
Yes, perfect.
This okay?
Yes, that's great.
Yeah. What needs to be done? What we need to do at the moment is we are asking government to give a compensation to persons with disabilities who lost their businesses. This will help them to have economic recovery programs, to help them to improve their livelihoods and also improve their families. Also, we are asking government to support the employment of persons with disabilities, those who lost their jobs, and also to reduce the tax exemption, especially those businesses that we are using tools that need to be taxed upon. And we're also asking the government to strengthen the employment laws. When COVID, so that in case anything comes again, we don't want to see that persons with disabilities are more affected. So we want to see that the laws are friendly for everybody. So also we are as in UDIPU, we are trying to input the regulations on a Disability Act and also Employment Act on how to see the employment of persons with disabilities not affected in case of in a disaster like this. So we also said that in anything, in any intervention, in a recovery, persons with disabilities should be consulted so that their ideas should be taken up in order to implement that program. And then the other thing also, we ask the government to give us a clear data of persons with disabilities that were affected by COVID, those who have lost jobs. Where were they working? How were their lives now? This will help us to plan and also to help in post-COVID time. So we also say that the government should have a intensive social protection program framework that inputs persons with disabilities, especially the vulnerable disability, the deaf, blind, the epilepsy, the mental health, the intellectual. How can this money be given unto them and their families to see that they cater and take care of these persons who are vulnerable, disabled? So we also ask government to have the program for recovery, but it should prioritize the persons with the disabilities. So we as NUDIPU, we are seeing and we are looking forward to mobilize persons with disabilities on how best to achieve from this program of recovery. Lastly, on the education sector, we are continuing with, people are continuing to learn homes. So children with the disabilities are continuing to learn. University students are also learning. So that's what we are saying, that it's good now. So the recommendations from health, I think it's already talked about. Why am I saying so? If we have a job, if you have a job and you have health, you can work. But if you don't have a job and you are sick, life is just nothing. So I think that is what I can give for now. Thank you very much.
Deborah, thank you, and thank you for helping us to look back at the experiences, but also the expectations of when we're looking forward. That's very, very kind of you. Stefan, I see you've joined, which is absolutely fantastic, because you were also very kind to step in at the last moment to take over from Jürgen, who I explained earlier was not well today. And so we'd like to end the conversation with you. looking at a more global perspective. We've heard a lot now from within Uganda as an example of both the economic recovery and the of it, and also the experiences of the disability, a larger kind of global view. We've seen, of course, that the economic impacts have tended to be very visible fairly quickly in the first wave of containment measures in many countries. What we've tended to see, of course, is a dramatic fall in economic activity, as Douglas was explaining, but also very significant impact on employment. We also have seen throughout 2020, depending on the country, the business sector, and the effectiveness of stimulus packages, that economies to a certain degree have recovered as the years progressed, or are recovering, but of course are at constant risk of repeated waves of the virus. But how do you see it at a global level, particularly in terms of disability and practically in terms of the effectiveness, the inclusiveness of social protection approaches, which Deborah talked about, and the importance of them, not only to provide a safety net for people with disabilities who've been economically impacted in those early stages, but also in terms of supporting people with disabilities to get back into productive work. Stefan, if you can unmute and turn your video on and give us your views from that ILO global perspective.
Yeah, thank you, Simon. I've been listening to both to Douglas and to Deborah. Deborah, good to see you. We met many years ago during the negotiations, and both presentations are quite good snapshot also of my impression of the global impact. And let me explain myself. If you, as you know, we coordinate in the ILO Global Business and Disability Network, in which we have global companies, we have national networks, more than 30 networks. Last year we saw the network being established in Uganda. We support the one in Kenya. And if you look at within that part of the world, the impact of COVID-19, there was a certain impact at the very beginning of the process, but then to some extent, the commitment to disability inclusion was kept, was maintained, even sometimes increased. I remember listening into the launch of the Kenyan network, and the representative from the Federation of Kenyan Employers, so the counterpart of the Federation of Uganda Employers, also said something more or less that the COVID had highlighted the relevance of diversity and inclusion, and in particular also disability inclusion issues. No? It's like bringing a more humane approach to companies, was the way the head of the Federation of Kenyan Employers put it. And when I've been speaking to many of our global companies, members of our global network, and when I've been asking them, has there been a negative impact of COVID-19 on your commitment as a company to disability inclusion? In general terms, the answer has been no. It has even been, in many companies, there has been even more intention, more awareness. I'm thinking of the Indian Business and Disability Network has been doing an amazing number of events throughout the pandemic. But that is a small part. That is those people that are, including people with disabilities, that are working in the corporate sector. If you go out of that and you go towards people that are self-employed, that are working in the informal economy, people that don't have the luxury of being able to work from home, telework, people that are dependent almost on a daily basis on getting out into the streets and generating their income, which does not come through a payroll, the situation is very, very different. Very much the same situation that Deborah has highlighted. No? The issue, and especially in those contexts where the interlinkage between the health situation, the lockdown situation, the security situation, and employment is much more prevalent. No? You're asking me something about social protection. Definitely, social protection has been used in many countries as an emergency measure to bring cash to those households that needed that cash. It has benefited in many cases persons with disabilities. There are many examples of disability targeting within that, especially in countries where you would have a pre-identification of households with disabilities. So it has brought back this discussion about, do you need a disability card, a certificate? I was never a great fan of those issues, but in that specific circumstance, it really showed that out that you could not come with a targeted approach on households with persons with disabilities. No? So well, many of us have now started to rethink some of those issues. No? Of course, social protection continues to be badly designed in many countries. It continues to lead to often require for people not to be able to work. But in those countries where the social protection has been there, it has played a role. But definitely also we need to use this crisis, which has shown the inadequacy of many of the solutions. We need to use this crisis for this back better that you also mentioned in your theme as for this session. So we need to make that a reality, no? And building back better requires OPD involvement that Deborah so rightly pointed out. It needs disability disaggregation in statistics. When you ask us very often, do you have statistics on the impact of COVID-19 on the employment situation of persons with disabilities? Well, the answer is normally no, because even when we in the ILO did some rapid assessment surveys, we usually did not include disability disaggregation questions in it, so we could not identify the impact it had on persons with disabilities. No? So we need to learn from that. That cannot not happen again. We need to definitely have OPDs sitting at the table, at the right tables. There are opportunities that are coming towards us. The digital economy, which is now exponentially growing, also in the country context. We need to make sure that people with disabilities have the competence and skills. You have been supporting a very interesting initiative in Kenya on that. We need to replicate, upskill, and increase these initiatives. There is also, everybody speaks, the response to the crisis needs to be a green response. There are jobs that will be created. We have looked into that in the ILO. There are jobs that will be created by this move from a carbon intensive economy to a low carbon economy. But again, if we don't act altogether, not so many of these new jobs will go to persons with disabilities. No? So so there are huge opportunities there, but we need to increase our efforts at all levels. No, I think we are doing better. I mean, the level of awareness also within the UN system, which in certain countries plays a certain role, the awareness is much higher. We have now a UN disability inclusion strategy under which we need to report to the UN on how we are including persons with disability in our work. It's helping us, it's opening doors, but it's not enough. No? We need to have more support. We also, as you know, we are working with trade unions. We also need to have trade unions more proactively putting that issue on the agenda. Uganda has been a good example of, I think, thanks to the work of NIPO, of reaching out to the trade unions, also to bring the disability inclusion also as a key element of the tripartite response to the crisis. No? So a lot of work ahead of us with some interesting opportunities, with some good examples. I think better off now than if this crisis would have hit us 5 years ago or 10 years ago, but still it has shown things that new systems are still not good enough. Our employment initiatives, our public employment initiatives, they're still not yet at the level that they should be to ensure that people with disabilities will come out of this crisis and will be one of the target groups. As Deborah was very right. I mean, I think all the measures that Deborah showed us on her slides, I can just endorse all of them. They apply to Uganda as in the same way as they apply to everywhere else. Thank you, Simon, for inviting me to join this session. And sorry to have a bit late, but I had another just today.
No problem. And thank you, Stefan. You were very kind to step in, and thank you for that really insightful piece of thinking. We've got time for one question, and thankfully we have one question for each of the three speakers. It's come from Alison Marshall, and she rightly says we have so many changes that we want to see from government and from companies, and of course also some improvements to celebrate. The question from Alison is, if each speaker had to choose just one priority change, what would it be? Yeah, if we had to pick just one thing to change because of our experiences of the last year, what would it be? Let me start with Douglas, and then I'll come to Deborah, and then finally to Stefan. Douglas, if you had to from your experience of the last year, if you had to go for one change, one priority moving forward, what would it be?
I think for me, that priority would be integration of disability inclusion within our national employment planning framework. It has often been seen as a side issue, so we tend to neglect it, or we tend not to prioritize it, or not even to budget it for it at all, because it's considered a side issue. The same thing at company level. I would like to see a company seeing a person with disability as integral to the organization, not some side staff who requires some side additional treatment and handling. So for me, it's about integration. Thank you.
Brilliant. Thank you, Douglas. We'll make it happen. Deborah, the same question to you. Based on your experiences of the last year, if you had to choose one priority change, what would it be?
Okay, thank you very much, Alison, for that question. Development Plan 3.
Oh, sorry, Deborah, your interpreter again has gone a bit quiet. If she could come close to the computer, be fantastic. There we go. We even see you. That's nice.
Okay, sorry. Our National Development Plan 3 recognizes disability as a cross-cutting issue in all the 16 sectors. So in order to implement that plan, there must be a provision for budget, a provision for activities, a provision of indicators in all the implementation of that National Development Plan. That's what we want the government to take over.
Thank you, Deborah. Again, very, very clear, very specific. And Stefan, finally, back to you. Again, from your experience over the last year, from an ILO perspective, what is the one thing that you would really like to see changed?
Well, I must admit that both Douglas and Deborah are taking away my thinking, because it's about full inclusion of disability in all initiatives. If you think about the private sector, but also if you think about the rural economy, which is a big it's not about coming up with segregated specialized solution. No, we need to fully include persons with disabilities in the different mainstream initiatives that all our countries will be doing. Some will focus more on this, some will focus more on digital economy, some more on the green jobs, some more on rural employment. Usually countries will focus on all. People will need to be central initiatives, and that will require for OPDs to be sitting at all these tables.
Fantastic. Thank you, Stefan. 3 brilliant priorities, which I think hopefully will help us think very carefully on how we make them happen. Again, to Douglas, to Deborah, to Stefan, thank you very, very much for that second half of this session, opening up the IDDC General Assembly. For everybody who stayed on a little bit over time, thank you. And we'll be ending there, and hopefully everybody can for tomorrow sessions, and as we continue throughout the week. But for now, thank you very much, and we'll talk soon. Thank you.